while we have everyone connecting. Thank you for joining us. Okay, dear colleagues, we are ready now to start the World TB Day talk show. I'd like to turn over to Dr. Teresa Kasaeva, Director of WHO's Global TB Program. Over to you.
Thank you very much, Monica. Dear distinguished colleagues, partners, and friends, I am Dr. Teresa Kasaeva, Director of the WHO Global Tuberculosis Program, and I'm very pleased to welcome you today to this important online talk show to commemorate World Tuberculosis Day. This is annual talk show event, high-level event, and this year the slogan of the World TB Day is "Yes, we can end TB." That inspires, aim to inspire hope and encourage high-level leadership, increase focus, attention, investments to accelerate really efforts to recovery from COVID-19 impact and move towards our ambitious but reachable goals to end TB by 2030. And despite of all the impact, we have much better opportunities with the new diagnosis treatment options, and they can make treatment outcomes much better, and we can significantly reduce suffering and death from this preventable and curable disease. We have very rich agenda today, and I'm very pleased to welcome our distinguished lineup of speakers today. They are all powerful voices for the fight to end TB, include TB survivors and advocates, civil society, honorable ministers of health, ambassadors, heads of agencies, partners, and WHO leadership across all three levels. We plan to have a very interactive format today. If you have questions, please use the Slido link posted on the chat. This talk show will be also streamed on our WHO platform NTB forum, and we urge you also post questions there. Please note also that there is interpretation available in all 6 UN languages, and kindly use the interpretation button on Zoom to choose your language. To start this one of its kind talk show, I'm very honored to welcome Dr. Tedros Adhanom Ghebreyesus, our Director General, who will open the talk show with his opening address. We appreciate, Dr. Tedros, your strong commitments and very unwavering leadership. You are really our champion and leader in the fight against TB. Dr. Tedros, the floor is yours.
Thank you, Teresa. Your Excellency, Ambassador Jen Shu, honorable ministers, distinguished delegates, dear colleagues and friends. On World Tuberculosis Day, we pay tribute to the millions who lose their lives to TB and the millions who continue to struggle daily against this preventable and curable disease. We also salute those on the front line combating this disease and saving lives. The theme of World Tuberculosis Day this year is short and to the point. Yes, we can end TB. Our goals are both ambitious and necessary. Tuberculosis kills 1.6 million people each year and affects millions more, with enormous impacts on families and communities. The situation has been made even worse due to disruptions to essential TB services caused by the COVID-19 pandemic and conflicts across Europe, Africa, and the Middle East. In the face of so many challenges over the years, we have made significant progress. More than 74 million people have received access to TB services since the year 2000, and that's good, but it's not nearly enough. Ending this debilitating disease is a priority for WHO, which is why I'm pleased to announce that the WHO flagship initiative on TB will continue for a further 5 years until 2027. The initiative's current work supporting countries to advance research and increase access to TB prevention and care will expand to include multisectoral engagement, pandemic preparedness, and universal access to care, along with new targets. These new targets will inform the upcoming UN high-level meeting on TB at the General Assembly in September. Let me explain briefly the initiative's strategic approach, which is focused around 5 priorities: engage, accelerate, align, account, and advocate. First, to engage by fostering collaboration in countries across sectors, partners, and civil society. Collective action is critical for country impact. Civil society and communities play a key role in efforts to end TB, including on social determinants, gender equality, and the response to and recovery from the COVID-19 pandemic. Second, accelerate with fast-tracked uptake of the latest WHO recommendations, operational strategies, policies, and innovations. Today, as a first step, WHO and partners are issuing a call to action urging member states to accelerate the rollout of new WHO-recommended shorter all-oral treatment regime for drug-resistant TB. It's vital that efforts to end TB are integrated into primary health care to close gaps in access to prevention and care. This must be supported by increased investment, including in research and innovation, to increase equitable access. To support the development of TB vaccines, WHO announced a new Vaccine Accelerator Council in January. Third, to align by synergizing our work with other global health actors and with partners in countries. This includes ongoing work on primary health care, antimicrobial resistance, and pandemic preparedness. Fourth, accountability. Implementation of WHO's multisectoral accountability framework on TB will help to engage all relevant sectors addressing the key drivers of TB. Fifth, advocating for accelerated action and increased investments through a targeted advocacy and resource mobilization plan. The initiative includes new targets for the next 5 years, including universal access to WHO-recommended diagnosis, treatment, and prevention, development of new vaccines, and social protection and increased financing. As we prepare for the second UN high-level meeting on TB in September and the multi-stakeholder meeting in May, I urge you to advocate for the highest level participation from countries, to work closely with civil society, and to contribute to re-energize commitments to end TB. My thanks to Her Excellency Professor Peng Liyuan, First Lady of the People's Republic of China, and WHO Goodwill Ambassador for Tuberculosis and HIV/AIDS for her strong support and advocacy. My thanks also to Your Excellency Ambassador Chen Shu for being with us today and for delivering the statement on behalf of the First Lady. And thank you all once again for your partnership and leadership in the fight against TB. We must maintain momentum to stop the spread of this ancient disease and reach those affected with the care they need. Yes, we can end TB. I thank you, and Teresa, back to you.
And we thank you, Dr. Tedros, for your inspiring words and opening of this talk show with the launch of the momentous flagship initiative, which will set the stage for the preparations for the UN high-level meeting on TB, and we hope will guide community during the next 5 years. We appreciate your leadership and support. It's now, dear colleagues, my great pleasure to introduce Honorable Mr. Cheng Shu, Ambassador Extraordinary and Plenipotentiary, Permanent Representative of China, who will share with us the keynote statement on behalf of Her Excellency Professor Peng Luan, First Lady of the People's Republic of China and WHO Goodwill Ambassador for Tuberculosis and HIV/AIDS. Your Excellency, please.
谢谢主持人。首先感谢谭德赛总干事热情洋溢的支持和他和世卫组织对结核病防治的重视。下面我荣幸地宣读彭丽媛教授的书面致辞。我引述：尊敬的谭德赛总干事、女士们、先生们，值此第28个世界防治结核病日到来之际，我谨向世界卫生组织举办是的，我们可以终止结核病宣传活动表示诚挚的祝贺，向一直以来为结核病防治工作倾注心血的广大卫生工作者和各界人士致以亲切的问候。结核病是危害人类健康的重大传染病，终结结核病流行对于增进各国民生福祉、促进全球可持续发展具有重要意义。近年来，在世界卫生组织积极推动和国际社会的共同努力下，全球结核病防治取得了显著的成效，发病人数和死亡人数都明显下降。中国政府高度重视结核病防治，将此项工作纳入健康中国战略，不断提升保障水平，开展多部门合作，呼吁全社会参与，并积极推广新的诊断技术、新的治疗方案和新的管理工具。结核病患者的治愈率始终保持在90%以上。我参与结核病防治工作10多年来，亲历了中国结核病防治工作的不断进步的过程，也见证了中国结核病防治志愿者队伍的发展壮大。志愿者们积极开展结核病防治知识宣传，为患者提供帮助和支持，为营造全社会参与结核病防治的良好氛围汇聚力量。来自中国湖北省的结核病防治志愿者果果曾经是耐多药结核病患者，在经历了2年的治疗康复后，他主动成为结核病防治志愿者队伍中的一员，不仅为病友提供帮助，还带动更多的人加入结核病防治志愿工作。果果说，因为自己淋过雨，所以想为别人撑起伞。在世界各国还有许多像果果一样可敬可爱的志愿者，我为他们的无私奉献而感动，向他们表示诚挚的感谢。当前，结核病依然是严重危害民众健康的全球性公共卫生问题。终结全球结核病流行仍然任重道远。在此，我呼吁各方积极履行承诺，加强资源投入，开展交流合作，分享防治经验，共同提升全球 结核病防治工作的能力和水平。作为世界卫生组织结核病和艾滋病防治亲善大使，我愿与大家携手同行，积极参与结核病防治事业，关心关爱结核病患者，用爱与行动守护健康。我相信，经过各方的共同努力，我们一定能够如期实现终结结核病流行的目标，为构建人类卫生健康共同体做出更大的贡献。谢谢大家，引述完毕。谢谢主持人 ，Thank you.
Our deepest thanks to Her Excellency Professor Pen Luan, First Lady of the People's Republic of China, and WHO Goodwill Ambassador for Tuberculosis and HIV/AIDS, for her strong engagement and voice that has contributed immensely to ensuring a high-level spotlight on ending tuberculosis and immobilizing countries to accelerate their TB response. And our thanks to Ambassador Cheng Xu for joining us in person to deliver this statement. We are honored. Honorable colleagues, we have today many eminent guests, but really very special one, and we're very pleased to have with us Ms. Caroline Mburu, a young student, TB survivor and advocate from Nairobi, Kenya, joining us to share her story and her perspective call on accelerating the response to end TB. Welcome, Caroline. We look forward to hearing from you.
Thank you. Thank you. Good afternoon. My name is Caroline Mburu, a student, a TB survivor and champion working closely with Stop TB Kenya and the network of TB champions. I still remember the symptoms I experienced when I was diagnosed with TB, and to date, this still gives me shivers. It took me almost 2.5 months to get diagnosed with TB, and within that time period, the suffering was real. Non-stop coughing, night sweats, joint pains, loss of appetite, intense chest pains, vomiting, and weight loss. I relive those symptoms every time I talk about my TB story. This is the everyday reality of TB survivors around the world. A sad reality that I would not wish on any more persons. Being a survivor, I have experienced the suffering, both physical and emotional, that comes with TB. I have had to put my life on hold because my body was too weak to operate normally. I also have gone through immense stigma that thousands of other TB affected persons are going through now. I was so afraid of being shunned, I never told my closest friends about TB. I would therefore confidently say that TB affected persons are not having it easy, and it is time we brought this unnecessary suffering to an end. I feel like if I had been diagnosed earlier, my condition would not have deteriorated. Maybe I would not have had to pause my internship, and my life would not have come to a standstill. Ending TB will not only help to save millions of lives around the world, but also end unnecessary pain and suffering caused by the longer and toxic drug regimens. Just like everybody else, TB affected persons have the right to lead normal lives. It is the dream of every TB survivor to not only see transmissions prevented, relapses eradicated, drug-resistant TB prevented, but most importantly, TB ended. Today, I am happy with the progress made by WHO and partners as new call to action on shorter, all-oral treatment regimens for drug-resistant TB will be launched. As a TB survivor, I urge member states to accelerate the rollout of this regimen as soon as possible. My vision is to live in a world where TB is no longer a threat, especially to our most vulnerable and marginalized communities, where early detection is a norm and treatment is easily accessible for all. A world where no one is dying from a treatable and curable disease, a TB-free world. I would therefore like to call upon all governments to join hands in the fight against this deadly yet stoppable disease. This year, we have a perfect opportunity for our voices to be heard. as heads of states will come together to deliberate on accelerating efforts to end TB for the second time at the 2023 UN High-Level Meeting on TB at the General Assembly in September. All interventions and activities directed towards ending TB needs government support in terms of adequate funding and investments. My future and that of my generation depends on your commitment to end TB. Yes, we can end TB. Thank you.
Thank you very much, Caroline, for your courage, for your strong voice and advocacy. We should work, all TB community, for people like you and with people together with you and your colleagues and friends. Thank you very much once again. As we've heard already from our eminent speakers, 2023 is a pivotal year for the fight against TB, and we will have our second high-level UN General Assembly meeting on TB. And this year is unique also because there will be three meetings focused on important health topics, UHC and pandemic prevention, preparedness and response. So for TB is also a unique opportunity to showcase how UHC principles and pandemic preparedness and response should be implemented really to accelerate efforts towards ending TB. Heads of states will come together and to review progress to date and also to agree on the next steps to reach the targets. The whole process is led by two amazing and passionate co-facilitators of high-level meeting on TB. They're Poland and Uzbekistan, appointed by the President of the UN General Assembly. And we are very pleased to have today His Excellency Ambassador Mr. Krzysztof Szczerski, Permanent Mission of the Republic of Poland to the UN, and His Excellency Ambassador Mr. Bakhtiyor Ibragimov, Permanent Mission of the Republic of Uzbekistan to the UN, address us. I met them in New York just a day ago for a special UN missions briefing on preparations to the high-level meeting. And we've been really impressed by the interest. Over 50 missions joined us with a great interest and enthusiasm to contribute and to develop really strong political outcome document, and to raise their voices to accelerate efforts. Let us first hear from His Excellency Ambassador Mr. Krzysztof Szczerski, Permanent Mission of the Republic of Poland to the UN.
Excellencies, dear colleagues, it is a pleasure to welcome you today at the World TB Day online talk show organized by the World Health Organization. On behalf of my dear colleague and co-facilitator, Permanent Representative of Uzbekistan, Ambassador Bakhtiyor Ibragimov, and myself, we express our gratitude and appreciation to Member States for the engagement and constructive approach in the negotiations of the modalities resolution, especially for their support towards the agreeing on the date of the high-level meeting during the high-level week in September this year. Now that we have the modalities resolution adopted, it is important to discuss the next steps building towards a successful high-level meeting on TB and action-oriented political declaration. Today's online talk show presents an important opportunity to discuss ways to increase political commitment and action towards ending of the TB epidemic. Excellencies, the global tuberculosis epidemic is a serious threat to global health. It is preventable and curable. Provision of the TB services saved 74 million lives since 2000. However, the disease continues to inflict immense suffering on countries, communities and families throughout the world. Close to 10.6 million people fell sick with the disease and 1.6 million died in 2021 alone, making TB one of the biggest infectious killers worldwide. TB has existed for hundreds of years and killed several hundred millions of people. Yet the only effective vaccine was first introduced for use in humans more than 100 years ago, in 1921. Although treatment has evolved through many new breakthroughs, this is mainly used to treat drug-resistant TB, and research for new vaccines has been extremely slow compared to development of the COVID-19 vaccines in just within 24 months. A focus on TB is particularly relevant for all airborne diseases, including COVID-19 and other respiratory illnesses, not only to protect people from infection, but also because practitioners trained to diagnose and treat TB can very easily pivot to deal with emerging threats of the similar nature. We would like to draw your attention to the fact that TB cannot be seen in isolation from other diseases. The high prevalence of the HIV and TB co-infection is well known, and it bears particular attention to the growing concern of antibiotic drug resistance. Close to 500,000 people develop the drug-resistant forms of TB annually, but less than half are diagnosed. Disruptions caused by the COVID-19 pandemic caused hundreds of thousands of excess illnesses and mortality, worsening the human catastrophe and immense suffering during this unprecedented time. 1 in 2 people with TB face catastrophic costs because of their illness, exacerbating poverty and hunger. TB, therefore, also is a challenge to development. At the 2018 UN General Assembly meeting on TB, we agreed that the TB was a national and global health threat of the highest priority, signing a historic declaration that promised universal access, multisectoral responses, innovative tools, and accountability for progress against the epidemic. Despite ambitious commitments contained in the declaration, there are still many challenges in ending TB. This is why, in coming intergovernmental process leading to the high-level meeting on the fight against tuberculosis will be critical to promote political visibility and key challenges in TB and to mobilize funding and action to properly address them both at the domestic and international level. We need to get to the TB response back on track to reach TB targets and save lives. We should all act together and increase our commitment to prove, as it's highlighted in this year's spotlight, yes, we can end TB. Thank you.
We thank His Excellency Ambassador, the permanent representative of Poland to UN. And let's now hear from His Excellency Ambassador Mr. Bakhtiyor Ibragimov, a permanent mission of the Republic of Uzbekistan to the UN.
Excellencies, distinguished participants of the World TB Day talk show, ladies and gentlemen. I have the honor to address you in my capacity as the co-facilitator of the preparation process of the upcoming United Nations General Assembly high-level meeting on fighting against tuberculosis. At the outset, I would like to commend the WHO for convening this important commemorative event aimed at inspiring hope and encouraging leadership, increased investment and innovation, and accelerated multisectoral action to combat the TB epidemic. Avail this opportunity, I would like to express my sincere appreciation and gratitude to those who dedicated their lives, knowledge, and passion to fighting against tuberculosis: doctors, nurses, healthcare workers, researchers, experts, representatives of public service, academia, civil society, private sector, and all stakeholders committed to eliminating TB as a public health threat. We actively prepare for the second high-level meeting of the General Assembly on tuberculosis slated for September this year. It's our moral responsibility and duty to combine all our efforts to identify gaps and solutions to urgently end the global TB epidemic. We encourage all member states and stakeholders to actively participate in this process and make their contribution in setting a new TB agenda of the world for the coming years. I, with my dear colleague Ambassador Sergejewski of Poland, are strongly committed to ensuring an open and exclusive and robust preparation process. We are ready to work actively with all stakeholders with a view to produce a concise, action-oriented and ambitious political declaration, generating solid momentum to achieving our common noble goal of ending the totally curable disease by 2030. Let's set up our efforts in order to prevent further spread of TB and save millions of lives by ensuring equitable and affordable access to high-quality, effective diagnosis, treatment, care for TB, as well as by promoting adequate and sustained investment for the TB response and for the development of safe and effective vaccines. It's our hope that the upcoming General Assembly high-level meeting on ending TB will create a bold and ambitious commitment to revive and strengthen a united response to the epidemic. We have every instrument, knowledge, and resources for the ending the TB. Together, we can call for a more robust action at the national, regional, and global levels in order to accelerate the implementation of the TB-related target of the 2030 Agenda for Sustainable Development. In conclusion, I would like once again express my gratitude to the WHO for convening this event and assure you of our readiness to work closely in the coming days and months to successfully organize the high-level meeting on tuberculosis. Yes, we can end TB.
And we also thank and appreciate the leadership of our amazing co-facilitators and thank His Excellency Ambassador of Permanent Mission of Republic of Uzbekistan and Republic of Poland for their really strong leadership and collaboration with WHO. Dear colleagues, I would like now to give you a brief introduction of the further agenda. We will have two high-level panels. And the first panel will bring ministers of health, our regional leadership of WHO. And the second panel will bring heads of agencies and partners. And these two sessions will be followed by the question and answer session. We expect really a constructive dialogue with overview of our progress to date, challenges, but also achievements, because many efforts have been spent and a lot has been achieved despite of impact of COVID-19 and other challenges. So let's move to our first panel, and I'm now pleased to invite Dr. Ahmed Al-Mandari, WHO Regional Director for the Eastern Mediterranean, to showcase regional priorities and leadership in the lead up to the UN high-level meeting on TB. Dr. Ahmed Al-Mandari, the floor is yours.
Thank you very much, Teresa, for your kind introduction. It is my great pleasure and honor to be with you here in this important meeting and discussion, and looking forward, to take further whatever recommendations that will come from today's meeting and discussions, as well as other earlier discussions on this important agenda item. Dear brother, Dr. Tedros, Your Excellencies, distinguished colleagues, good afternoon, good evening to you all. World Tuberculosis Day 2023 is of a particular significance as the United Nations General Assembly's second high-level meeting on tuberculosis is coming up in less than 6 months, specifically on 22nd September 2023. At that meeting, I'm sure countries will report back on progress and challenges on the road towards our end TB goals that have been set a long time ago, the SDG agenda, and the implementation of the political declaration from the last high-level meeting that was held in 2018. And here I expect that member states from the Eastern Mediterranean region, as well as other regions, will be proud to represent themselves at this high-level meeting and report back on whatever progress that they managed to make. We all know, despite the different challenges that we are all facing at different levels in IMRO and beyond. I can think here on that important meeting, to go ahead with that, on 3 critical points where I hope we will see progress from now until we go to that important meeting. Point number 1, we are lagging behind, unfortunately, in the areas of prevention. And giving numbers globally, only 42% of the 30 million people targeted in 2022. I'm sorry, Teresa, can you hear me?
Yes, we can hear you clearly. Please go ahead.
Very good. Someone came to my office and told me that they cannot hear you. So thank you. I'm glad for that. Thank you, Hala. So I'm sorry for the interruption. Globally, only 42% of the 30 million people targeted in 2022 benefited from preventative treatment. And unfortunately, in the Eastern Mediterranean region, we are not even at a quarter of those eligible for such service. We have untapped, potential to reduce transmission in those who could benefit from this intervention, including children and people living with HIV. We need to intensify the prevention efforts, which are among the most effective public health interventions, as we all know and agree. As we prepare for that high-level meeting, I would encourage countries to report back on the number of the people they put on preventive treatment and to think of ways that we could make more progress on that area. Second point that I'd like us to share, we continue to fall short of mobilizing sufficient financial resources for our TB response. Globally, again, less than half of the 2018 commitment target has been achieved. And in our Eastern Mediterranean region, less than half of the funding comes from domestic resources, which indicates, a prevailing dependency on external donors, putting us in that sort of type of challenge when it comes into maintaining and sustaining, or having sustainable funds. Without sufficient sustained national financial commitment, countries cannot provide the care that is needed and expected from them, including to those who are most vulnerable. We need to continue support our countries so that they increase their financial commitment in an efficient, integrative health system strengthening approach. To get ready for September meeting this year, I would just like to encourage our countries also to document their domestic financial TB program contributions and to propose plans on how they could be increased by different ways. And then my final point on that, as TB is a social disease that thrives on poverty and malnutrition, countries need the whole of society approach, a multisectoral approach. As we keep hear this word from Dr. Tedros since the beginning of the pandemic. And even that concept was there before, but during the pandemic, this sort of concept is real proof to us that we have to follow this sort of approach. Multisectoral, the whole of society, the whole of government approach. As I said, as just we did for COVID-19, in line with our regional vision here in IMRO, in fact, health for all by all. We have seen remarkable efforts and impact in introducing the TB multisectoral accountability framework in countries, including in those moving towards TB elimination. In preparation for that meeting also, it would be a major inspiration if countries would prepare good practice examples and success stories, highlighting how multisectoral approach and the whole of society approach have contributed, in fact, to improving TB care in their settings, to let others learn from these sort of success stories. Our work to end TB goes beyond these three elements, definitely. I'm just sharing with you this, but it goes beyond these three elements. And I'm sure that we will hear about these sort of elements in this meeting today. But if we could seize the opportunity of the September meeting to make progress on prevention, financial commitment, and multi-sectoral approach, that would amount to a massive setup of our successes forward until we reach our SDG targets by 2030. Most importantly, I'd like us to conclude by saying, yes, we can end TB. And I have no doubt of that if we come together, bring our wisdom, and have collective efforts on such important target. Thank you very much, Teresa, again, and it is my great pleasure and honor to be with you today in this meeting. Back to you.
Thank you very much, Dr. Ahmed. Thank you for your leadership and tireless work. And indeed, you are so right. We all understand our challenges, but we should also share more actively our best practices and exchange between the regions and the countries. And I would like also to highlight that under DG's first flagship initiative, support was provided to more than 100 countries, including 49 high burden countries in all WHO regions. The WHO developed and consolidated new guidelines that allow to shorten 3-4 times of treatment of the most severe forms of drug-resistant TB. 2 new drugs and 12 diagnostics were recommended by WHO. All WHO recommended oral medicines for the treatment of drug-resistant TB in children have a child-friendly formulations commercially available. 109 countries are using WHO recommended or all new treatments for drug-resistant TB, and 26 out of 30 countries are using rapid molecular diagnostic tests. Child-friendly formulations are available in 74 countries, and new effective drugs and treatments in general are available due to the joint efforts of member states, WHO, partners at Stop TB Partnership, USAID, UNITAID, Global Fund, manufacturers, and civil society. This brings us indeed hope that we can and must end TB. Thank you very much, Dr. Ahmed. And now we would like to turn to Brazil and welcome the address of Your Excellency, Ms. Nícia Trindade, Minister of Health of Brazil. Country is leading efforts in the regions of Americas on ending TB, not because of being high TB burden country, but also providing true leadership in research and innovations in the BRICS TB Research Network. And let us hear from the Honorable Minister now.
Neste Dia Mundial de Combate à Tuberculose, o Ministério da Saúde reforça o compromisso de combater essa doença que afeta países no mundo todo, principalmente populações mais vulneráveis. Estamos comprometidos em tornar o Brasil um país livre da tuberculose até 2030. Entre as nações com alto índice de transmissão, nosso país conta com a capilaridade e força do Sistema Único de Saúde, um sistema universal que oferece medidas de prevenção, diagnóstico e tratamento. É urgente a retomada de medidas para a redução dos casos, a ampliação da vigilância, do acesso ao cuidado e da continuidade do tratamento. A nossa meta e principal desafio está em alcançar as populações prioritárias para o enfrentamento da doença, como pessoas em situação de rua, pessoas privadas de liberdade, pessoas vivendo com HIV/AIDS, refugiados e comunidades indígenas. Para tanto, vamos nos valer dos aprendizados da pandemia de Covid-19, entre eles a inteligência epidemiológica, a saúde digital, o fortalecimento da rede laboratorial, o sequenciamento genético, incentivando dessa forma parcerias com comunidades científicas e instituições de pesquisa para construir em conjunto as ações de combate e prevenção da doença, para que juntos nós possamos atingir o objetivo estabelecido nas metas da Estratégia Global pelo fim da tuberculose e das agendas dos Objetivos do Desenvolvimento Sustentável. Por fim, reforço o compromisso do governo brasileiro com esse tema e ressalto que o Sistema Único de Saúde está unido a esta luta mundial pelo fim da tuberculose. Muito obrigada.
We thank Her Excellency Minister of Health of Brazil for your leadership and strong commitments to continue fight against TB. And now we move to the African region, and we look forward to hearing from Honorable Minister of Health for Zambia, Ms. Sylvia Masebo. Zambia is also among the 30 high TB burden countries, and we would like to hear from the Minister about progress made in the country, again, the co-epidemic of TB, HIV, and also they addressed effectively COVID-19. So how they managed using innovative approaches to address all three big issues. Here is the address of the Honorable Minister.
Dear Teresa, Your Excellency, dear colleagues, I will speak in Russian and уважаемые достопочтенные участники министерской группы высокого уровня, дамы и господа коллеги. Для меня большая честь выступить на специальном мероприятии в ВОЗ в честь Всемирного дня борьбы с туберкулезом, проходящего в этом году под девизом «Да, мы можем ликвидировать туберкулез». В последние годы Узбекистану удалось достичь значительного прогресса в преодолении медико-социального бремени от туберкулеза. За период с 2014 по 2022 годы, благодаря целенаправленной работе по охране здоровья населения от туберкулезной инфекции и предупреждению ее распространения, своевременной диагностики и лечения в рамках международных стандартов были спасены около 135 тысяч жизней. В результате реализации мероприятий, предусмотренных программами государства и международных партнеров, удалось снизить заболеваемость от туберкулеза на 23%, а смертность на 64% по сравнению с 2016 годом. Правительство Узбекистана на протяжении всего периода независимости демонстрирует сильную политическую поддержку борьбы с туберкулезом и проводит многосекториальные действия, чтобы покончить с туберкулезной. Тереза, слышно меня?
Да, продолжайте, пожалуйста, очень хорошо слышно.
Действия, чтобы покончить с туберкулезом. В рамках национальных программ по искоренению туберкулеза правительство, Министерство здравоохранения фокусирует на преодолении кризиса лекарственно устойчивого туберкулеза, чтобы устранить проблему в лечении и увеличении государственного финансирования программы и внедрения современных методов диагностики, лечения и профилактики туберкулеза в соответствии с актуальными рекомендациями ВОЗ. В частности, в рамках принятого в январе 2023 года постановления президента Республики Узбекистан о мерах по дальнейшему развитию службы в фтизиатрии и пульмонологии 2023-2026 годах, республика в ближайшие годы продолжит внедрять стратегию ВОЗ по ликвидации туберкулеза путем расширения доступа к качественной диагностике и лечению туберкулеза, путем приобретения противотуберкулезных препаратов первого и второго ряда из средств государственного бюджета, осуществляемых через международный механизм Global Drug Facility, который гарантирует поставки в страну качественных переквалифицированных препаратов по справедливым ценам, расширение диагностики и лечения латентной туберкулезной инфекции, обеспечение доступа к квалифицированной медицинской помощи для всех слоев населения, оказание помощи, ориентированной на нужды людей, оказание психосоциальной поддержки пациентам и их близких, привлечение общественности, организаций гражданского общества, а также всех поставщиков медицинских услуг к оказанию интегрированной помощи, интенсификация исследований и инноваций. Всемирный день борьбы с туберкулезом – это возможность уделить внимание людям, затронутым этой болезнью, и мы хотели бы присоединиться к призыву Всемирной организации здравоохранения и всех стран, членов Госассамблеи ООН, к ускоренным действиям, чтобы положить конец страданиям и смерти от туберкулеза. Этот же призыв Республика Узбекистан планирует озвучить в рамках заседания высокого уровня ООН, где нашей стране предоставлена высокая честь выступить в роли со-фасилитатора специального заседания по ликвидации туберкулеза. Благодарю за внимание.
Thank you very much, the Honorable Deputy Minister, Mr. Ulugбек Sabirov. Colleagues, we've just heard from the Honorable Representatives of Uzbekistan his statement, and where he shared with us the reaffirmed commitment to continue the tireless efforts to fast-track progress towards ending TB. And we really appreciate your leadership in preparations to the second high-level meeting on TB, and we'll be happy to continue our collaboration. And sorry for some technical issues, and we are now coming back to the Honorable Minister of Health of Zambia, Ms. Sylvia Masebo, to hear from her. Colleagues, apologize once again. As you could see, we have challenges and problems, not only in our core business fight against TB, but some issues with the connections. But I believe we will be able to hear a statement, very important statement of Honorable Minister of Health of Zambia. And now, meantime, we would like to move and to give floor to His Excellency Professor Mam Bunheng, Minister of Health, Kingdom of Cambodia. In Cambodia, there has been extensive progress made by the country towards ending TB, and due to these efforts, the country has transitioned from the high TB burden country list. And we are very pleased to have with us Honorable Minister with your address.
Honorable Dr. Tedros, the World Organization Director General, Excellency Minister, distinguished guests, ladies and gentlemen. Today I am very pleased and honored to speak at very important World TB Day that is organized by the World Organizations. On behalf of the Royal Government of Cambodia, I am very pleased to convey highest congratulations of Samdech Akak Mahasena Padai Hun Sen, the Prime Minister of the Kingdom of Cambodia, to World TB Day, just weekend and TB. We are all aware that COVID-19 pandemic has hindered year and progress made in the fight against tuberculosis and TB. As we together commemorate World TB Day this year, we stand in solidarity and redouble our effort to each and every get the TB target back on track. Together, just we can end TB. Cambodia is committed to ending TB by 2030. The Ministry of Health gives high priority to TB control and prevention. Despite challenges during the COVID-19 pandemic, Cambodia was able to have a 50% increase in case detection between 2021 and 2022. TB incidence and mortality rate has respectively decreased 50% from 2000 to 2021. And 2021, Cambodia transitioned out of World Health list of 30 high TB burden countries for the period of 2021-2025. However, the country remains on the global TB watch list, meaning that TB remains a priority. One set of the missing TB case is still our top task to address and close the gap. We are committed and have accelerated effort to update new World Organization recommendation, adoption, innovation, and accelerate action on TB response. The National Multi-Accountability Framework for the multisectoral engagement and accountabilities in our development, with particular consideration of our country success lesson learned and practice of the COVID-19 whole government response mechanism. We have to increase our effort to fight against tuberculosis, including one, investment in human resources. Second, more innovative way of care fighting for the missing case. Third, the use of more effective TB diagnosis tool and treatment regimens. Fourth, as well as research and study to generate evidence-based strategy encompassing TB patient pathway analysis, TB patient cost surveys, and national TB prevalence surveys. We strongly believe that if all together get united and committed to urgently accelerate TB response, we would reach NTB and SDG target by 2030. Together, yes, we can end TB. Thank you.
And we also sincerely thank Honorable Minister of Health of Kingdom of Cambodia for his leadership. Let me now give floor, and I'm very pleased to invite Dr. Hans Kluge, Regional Director of the WHO Regional Office for Europe, to share regional efforts to fast-track progress towards ending TB, especially in the face of the current war in Ukraine and its impact on Ukraine itself and neighboring countries. And we look forward to hearing about priorities and innovations led in the region. Here is an address from Dr. Hans Kluge.
Friends, colleagues, partners, greetings from WHO's European region covering 53 countries across Europe and Central Asia. A region where ending tuberculosis remains unfinished business, yet a region that has the know-how to finish TB. 141 years ago, on 24 March 1882, Robert Koch identified Mycobacterium tuberculosis as the causal agent of a disease at the time considered incurable. Looking back from where we stand today, 24 March 2023, World TB Day, we have made huge strides in tackling this preventable and yes, curable disease, including the social and economic factors intertwined with TB. We should be well poised to end TB by 2035, given that we have long had the ability to diagnose and treat it and to prevent its spread. But the current reality is different. It's been 5 years since the first UN high-level meeting on TB. From it appeared ambitious targets that were supposed to have been achieved last year. Progress, however, has been dismal for many reasons. Numerous crises arriving faster than ever before, natural disasters, conflicts, COVID-19, all have contributed to severely impacting health systems, jeopardizing gains made, including combating multi-drug-resistant TB and TB-HIV co-infection. Just 3 years ago, prior to the pandemic, the European region was on a good path, with the fastest decline in TB incidence and mortality in the world. But the Global TB Report for 2022 provides a grim reality check. TB mortality in the European region increased in 2021 compared to 2020, and the falling incidence curve has stalled for the first time in 20 years. Colleagues, these are remarkable times for those of us working on TB. We must take full advantage of new technologies such as rapid molecular diagnosis, better and shorter regimens for prevention, treatment and care, and innovative digital health solutions. For the first time in the history of tuberculosis, we have treatment regimens that are just 6 months long for both so-called regular TB, drug-sensitive, and drug-resistant TB. When I was a TB doctor, I could never even imagine this. Now we can confirm a diagnosis of TB and drug resistance within hours and start treatment at once. A few years ago, we probably wouldn't have thought this possible. So yes, we do have the scientific and medical tools to recoup lost ground, but we urgently need stronger, consistent invested partnerships between member states, donor agencies and affected communities if we are to reach everyone living with TB with the treatment and care they need. Yet we all too often see fragmented approaches where various stakeholders continue to work in silos, such as those that still exist between TB and HIV, rather than collaborating and integrating efforts and resources. This, frankly, my friends, is a recipe for failure. We need strong leadership, boosted investment into people-centered care, even more research, and more support for introducing and scaling up innovations for TB. We also need to improve access, engage all service delivery platforms, invest in community-based services, and strengthen the connection with primary healthcare. Now is truly the right time to chart a renewed trajectory towards ending TB in the European region and globally, for once and for all. This September will bring the second UN high-level meeting on TB, co-facilitated by Poland and Uzbekistan, both WHO Europe member states. A real honor for our region. At the meeting, global leaders will commit to new targets and set new milestones to end TB. This should not be an empty exercise. Rather, these new commitments must lead to action and accountability at all levels. These commitments will be a promise we make to help people who are most in need. For TB is largely a disease of poverty and neglect, shrouded in stigma and discrimination, affecting some of the most vulnerable of our fellow human beings. Friends, you may have sensed that ending tuberculosis is close to my heart. Throughout my professional career, by collaborating with dedicated health professionals and supporting people living with this disease in some of the most challenging contexts on this planet, ending TB for good has been a passion of mine, an ever-present goal. Yes, I passionately believe we can and we will end TB together. Thank you.
And we also thank and proud of our regional leadership and regional and country teams that we work indeed across all three levels together to address tuberculosis and other biggest problems. And indeed, a situation in the European region is unprecedented, and support also to Ukraine and other countries also unprecedented. We are working closely with the partners, civil society, and this is really encouraging. Thank you once again very much, Dr. Hans Kluge. Dear colleagues, now I would like to give floor also to other representatives of the European region. We are pleased to have with us Her Excellency Katarzyna Drażek-Laskowska, Plenipotentiary for the Treatment of Refugees Abroad Director, International Cooperation Bureau, Ministry of Health, Republic of Poland. The country is leading, as we've told already, the way this year as a co-facilitator of the UN high-level meeting. Poland is also heavily engaged in ensuring continuity of TB services for refugees and displaced populations due to the conflict in the region. Dr. Katarzyna, please share with us your information, messages about ongoing national efforts to accelerate further progress and to provide timely support, continuation of the support for people with TB most in need, refugees, migrants. Please, floor is yours.
Thank you very much. Director General, honorable ministers, ladies and gentlemen, thank you very much for giving me the floor at this important event. I am honored to join such respectable co-speakers to highlight the necessity to strengthen global response to TB, one of the leading killers of our times. Tuberculosis, a curable and preventable disease, is globally the second most common communicable disease causing death. As already mentioned, according to the WHO data, an estimated 10.6 million people worldwide fell ill with TB in 2021, and a total of 1.6 million people died of it. TB is present in all countries and age groups, yet it has the biggest burden in low and middle-income countries, within the poorest and those in vulnerable situation, further deepening the inequalities and health gaps. The disease affects also strongly migrants and refugees who often suffer from hindered access to treatment and immunization programs. Drug and multi-drug resistant TB are two biggest challenges in this area, closely linked to another great health challenge of modern times, the antimicrobial resistance. COVID-19, HIV, and other comorbidities are no lesser challenge in the treatment process. There are a number of international initiatives aimed at eliminating TB. Countries' commitments in this area are well known. Eliminating TB is one of the commitments within the Sustainable Development Goal 3.3. Two United Nations high-level meetings on tuberculosis underlined the importance of TB elimination in global health discourse. I am honored that my country might contribute to these efforts by co-facilitating, together with Uzbekistan, the upcoming high-level meeting to be held in September this year. We are happy to be proud to be a part of this process, which is bringing the issue on global level. I would like to encourage you all to actively participate in the process of negotiation of political declaration on TB, reinvigorating the commitments and further pledging the efforts to end TB. The incidence of TB has been slowly falling down in recent years. Yet, the COVID-19 pandemic and armed conflicts around the world, causing economic instability, health crisis in inflicted areas, and disrupting the medical supply chains have put these efforts under big question mark. In 2020, there was a decrease of global financing of TB elimination efforts, and in 2021, there was a reverse trend in both number of people getting ill and the number of deaths. Enhanced commitments are needed to put these trends back into the right track. To renew our commitments and ensure progress, we have to use the best experience we had so far, addressing the social determinants of TB, prevention and vaccination, early diagnosis, universal access to treatment, engagement of communities, NGOs, and patients' organizations, and intensified research and innovations. These are the ways to have to follow to be successful. In Poland, TB incidence in 2020 was 8.8 per 100,000 inhabitants. Most Polish patients suffer from drug-sensitive tuberculosis. Data on TB is collected in the National Tuberculosis Register. There is a legal obligation to report every single TB case. Doctors must notify within 24 hours a suspected or confirmed case to the Sanitary Inspectorate. Treatment of TB-positive patients is obligatory and free of charge to everyone, both those with and without health insurance. Yet, Poland is facing a challenge, which is an influx of refugees from Ukraine, where the TB incidence rate is regretfully much higher than it is in my country. Polish and Ukrainian authorities and medical teams work closely together in this area, especially in the field of tracking and tracing TB patients. What is more, all Ukrainians are granted TB treatment on the same conditions as Polish citizens. Applying the Ukrainian treatment scheme is possible thanks to the support of WHO and international donors. We are grateful for this extremely important assistance. Thank you for this. Poland strongly supports keeping the TB team high on the political agenda. We believe it is imperative to remind tirelessly the progress made so far, the existing challenges and strategies to overcome these barriers. Thank you once more to WHO and all stakeholders for bringing us all today and make the space for discussion on how to move forward. Yes, we can end TB. Thank you very much.
Thank you very much, Honorable Katarzyna Dragik-Laskowska. Thank you for your collaboration, for your leadership, strong advocacy, and we are really impressed how deep you are diving in the subject. So your expertise is growing from day to day, and it's a real pleasure to work closely with you. No doubt that high-level meeting will be a very successful event due to the joint efforts, of course. Dear colleagues, I'm now pleased to share the address of Dr. Dante Saxona Harbuwono, Deputy Minister of Health of Indonesia. As you know, a country is one of the pathfinding countries that had made progress in scaling up access to TB services, including through engagement of other sectors and through the use of innovation, increased financing, despite of the COVID pandemic. Leadership of President Joko Widodo of Indonesia has been a key with his agenda to accelerate the elimination of tuberculosis. Let's us hear from Honorable Deputy Minister.
Dr. Tedros, Director General of WHO, Minister, Leader, and TB survivors. Over the past years, countries worldwide had an intensive battle with COVID-19. Most healthcare systems suffered, yet we could recover stronger by joining hands. Our collaboration with the international organization, developmental partners, scientists, government, community, and industries have proven that we can achieve things we never thought possible by working together. In tuberculosis, Indonesia has made a new history. Last year, Indonesia achieved the highest number of tuberculosis case notification of all the time, reaching 74%, or approximately 717,000 of estimated TB cases in 2022. This was also followed by the TB treatment success rate 89% for the target of 90%. Excellency, recalling the 2018 United Nations high-level meeting political declaration, Indonesia is aiming to reduce the incidence rate of tuberculosis to 65 per 100,000 by 2030. We are committed to accelerating TB elimination through massive case detection and multisectoral approach to control prevention. During Indonesia G20 presidency, we agree upon a G20 call to all action for financing for TB response. This should be perceived and an investment rather than expensive. And we should bring more leaders, government, and private to enhance the pooling and mobilization of global resources to high-burden TB countries. This thing, yes, TB elimination required to accelerate, scale up, and innovate current intervention. First, to accelerate, we to improve case detection significantly. During COVID-19, Indonesia could test 65 million people. We should apply similar effort in TB by utilizing artificial intelligence, advanced technology, and grassroots movement with health cadres and community. Second, to scale up the active case finding, public-private partnership, and stakeholder engagement standalone doctors, clinic, private hospital, and other private entities are now being encouraged to improve detection and reporting of tuberculosis. In addition, we are also scaling up the management of latent TB infection by tracing TB among HIV and diabetes patients and improving them with TPT. Third, to innovate by spreading up the research and development for TB vaccine or shorter treatment regimens. This is not impossible. During COVID-19, we were able to create a vaccine in less than a year. Today, on behalf of the Indonesian government and 1 million Indonesians affected by the disease, I call for everyone to join hands to increase TB investment and accelerate to scale up and innovate TB intervention. We have done it with COVID-19. Let's do the same in tuberculosis. Thank you so much.
And we also sincerely thanks Honorable Deputy Minister of Health of Indonesia. And we see on the example of Indonesia, one of the highest TB burden countries, that progress is possible. And when there is a high level of prioritization of tuberculosis, and even we really appreciate this leadership and commitments to push forward TB vaccines development agenda, because we all understand that new TB, effective TB vaccines could be real game changers in TB response. While we are moving towards the end of our first high-level ministerial panel, we will try once again to put the message of the Honorable Minister of Health of Zambia, Ms. Sylvia Masebo. Colleagues, sorry, we tried to do our best, but unfortunately there are technical issues. We hope still to hear later. This is end of our first panel, and for the next session, I now hand over to my colleague, Monica Diaz, cross-cutting lead at the WHO Global Tuberculosis Program on multisectoral engagement accountability, DG flagship initiative, and public-private partnerships.
Thank you very much, Teresa. Dear colleagues, you heard earlier from our Director General about the expanded DG flagship initiative over the next 5 years and the core priorities. One of the main focuses will be on the accelerated uptake and rollout of key WHO recommendations that can improve health outcomes of those ill with TB and drug-resistant TB, saving lives. The World Health Organization and its partners today are calling on governments and other stakeholders to accelerate the implementation of the novel 6-month all-oral regimen for the treatment of drug-resistant TB. This is extremely vital and urgent to reach the commitments made on ending TB. We would like to start this session with an overview of the backdrop to the call to action. and its content. I would like to invite my colleague, Dr. Fuad Mirzayev. He is team lead of the TB treatment team in our unit on prevention, care, and innovation at the Global TB Program. Over to you, Fuad, to share an overview.
Thank you very much, Monica, and colleagues. Can we put the slides on, please? So while we're putting on the slides, just to say that drug-resistant TB, as you know, continues to be a public health problem, having heavy toll on people affected by TB communities and healthcare systems. So first of all, I just want to present why we are releasing this call to action. Today, it is all stems back to the updated and consolidated guidelines on drug-resistant TB and operational handbook that we, the Global TB Department, released in December last year. And the main changes that we have in these guidelines are highlighted in red. So the 6-month regimen composed of bedaquiline, pretomaniate, linezolid, with or without moxifloxacin, so-called BPAL-M, BPAL regimen, is recommended for people with MDR or rifampicin-resistant TB, and those with additional quinolone resistance. WHO suggests to use this regimen rather than 9-month or longer 18-month regimens in MDR-TB patients, effectively making this regimen a regimen of choice for patients who are eligible. This recommendation had been based on the data and the evidence provided to WHO by partners from the TB Practical and Zinix trials, and both of them showed a much improved treatment success rate with a BPAL-M regimen compared to the current standard of care. The implementation of the BPAL regimen is also cost-saving in most settings, mainly because of the reduced time on treatment and therefore the reduction in outpatient costs, inpatient bed stays, and laboratory tests. WHO therefore recommended the rapid rollout of this novel regimen that has the potential to dramatically increase cure rates due to its high efficacy, allow broader access due to its lower cost, and improve patient quality of life as this regimen is all oral and significantly shorter. Therefore, we call for action, and these are the next slide. The main, the key priority actions that we see are important. First, of course, that's to make sure that there are patients to benefit from the regimen. Countries and partners need to increase access to rapid and conventional TB diagnostics, not only to diagnose TB, but also to identify rifampicin resistance and resistance to the drugs that are components of this regimen, bedaquiline, pretomaniate, quinolones, and linezolid. The action is needed to update national policies to incorporate these new recommendations without delay, and to allow, facilitate the use of the regimen in country, to initiate and ensure the continuous and affordable supply of the component medicines. In relation to that, the update in the national regulatory policies is needed to allow for the importation of these new medicines for this regimen, and also the diagnostics without restrictions and without unnecessary price margins. Countries need to seek technical assistance from partners to train all healthcare workers at all levels in the healthcare system, but also including the TB activists, and to make sure that everyone is familiar with the new regimens and ready to also support communities to implement this regimen. Countries may seek to learn from the experience of early implementers. There are some countries that started to use that regimen already, to inform their national policies and implement in a speedy manner. obviously, the rapid allocation of domestic resources is needed to allow the full coverage of this of all patients, and also when it is not sufficient, the countries need to seek funding from overseas donors. There is an urgent need to ramp up advocacy efforts to inform the public, decision makers, and multiple sectors of society, and ensure the establishment of accountability frameworks to accelerate progress in the implementation of the innovation. The engagement in community action to raise awareness and facilitate access to new treatments for all individuals is also needed. Many countries have a significant proportion of TB care dealt with the private sector, so the partnering with the private sector to ensure wider access for this innovation is also needed. The coordination with the partners to include the digital adherence and monitoring tools with the implementation of the new regimens, and strengthening the national pharmacovigilance systems to ensure prompt identification and management of adverse events. Last but not the least, there is a continuous need in action, in investment in continued research and innovation to expand and further the available treatment options for TB infection and disease. So with this, I thank you all and hope this background provides the scene for the intervention from partners that are joining us in this call to action. Monica, back to you.
Thanks so much, Fuad. That was really clear. Thank you for that overview of the call to action. We would now like to welcome our numerous partner signatories to the call to action. We have over 10 partners already signed up, and you will hear commitments from some of them. But as highlighted in Fuad's presentation, we really need to unite forces, and we welcome greater and stronger collaboration in this area. Please join us in this call and send us your statement of support. We would now like to call on the following partners to express their support. I'll start with the chair of the Global Drug Resistance TB Initiative and Regional Technical Director at FIND, Dr. Sarabjit S. Chadda. May I please ask you to connect and make your one-line statement of support, please?
Right. Thank you, Monica. The newer, shorter, more effective regimen has the potential to offer a faster and more effective cure to all drug-resistant TB patients. And the Global Drug-Resistant TB Initiative is fully committed to technically support the rapid implementation of this novel regimen as a standard of care and help all drug-resistant TB patients to achieve better outcomes, a better quality of life in a shorter duration of time. Thank you.
Thank you, Sarabjit. Very clear. I'd now like to turn to Dr. Philippe Duneton, Executive Director of UNITAID, to make his statement, a one-line statement of support. Over to you, Philippe. Okay, so maybe we are having technical difficulties. Apologies for that. We'll now turn to Dr. Lucica Ditiu, Executive Director, Stop TB Partnership, for your one line of support. Lucica, on the call to action, please.
Thank you very much. Thank you very much, Monica. And sorry that I don't have the right backgrounds or things from here in India. Varanasi, our commitment is to really ensure and push to do two things. One is in our advocacy efforts to ensure that the latest WHO recommendations for diagnosis, and this in this case particularly, access to the short-term treatment regimens for drug-resistant TB, to drug-sensitive TB, is secured for every single person that needs it. So that's one. And the other is, for those of you that are aware, we are doing a monitoring of country guidelines and their alignment, or how to say, their follow-up of the WHO recommendations. So we hope to come back next year with the data on how there is this alignment and to measure some of the things that Fuad mentioned in his presentation. We think, I heard Hans speaking, and we as old-time doctors, we couldn't believe that we will have one day in our lifetime that drug regimens, drug-resistant TB can be treated with short-term regimen with no side effects. You know, it's a moment very important, and we should make sure that this is not available just for people that are having easy access to this, but for everybody, especially for those most vulnerable and those having a lot of barriers to services. Thank you very much, Monica and Teresa. Thank you.
Thank you very much, Luchika. We'll now turn to Dr. Peter Sands, Executive Director of the Global Fund. Peter, over to you about the call to action, please.
Well, it's nice of you to call me a doctor, but I'm not. But that doesn't mean any limitation on our commitment to the call for action. As the largest provider of external funding for TB, we provide about 3/4 of external financing in the world. We are absolutely committed to helping accelerate the rollout of new, shorter, more effective regimens for drug-resistant TB in the context of wanting to accelerate progress against TB overall. Thank you.
Thank you, Peter. Thank you for the support. I now turn to Dr. Melvin Spiegelman, President and CEO of the Global Alliance for TB Drug Development, TB Alliance. Over to you, Melvin.
Thank you. I hope you can hear me now. And certainly thank you to WHO for organizing the joint call to action. It's unbelievably important. As the organization that really originated these regimens started and has worked on them for now close to 10 years, we are totally committed as individuals and collectively as an organization to really derive the full benefit of what this transformational treatment can do. But what we are also committed to, which I think is probably even more important, is to exponentially increase the supporters and the level of support to this call to action. That is what clearly will ultimately make a difference. We need to get so many more people. So I would really ask for everyone who is on this call, please step up and join us. Together, we can win this battle. Thank you very much.
Thanks so much, Mel. Indeed, a strong call for unity. We now turn to Dr. Gidado Mustafa, Executive Director of KNCV TB Foundation. Over to you, Gidado.
Yeah, thank you very much, Monica and the WHO team. To my sister, Caroline, and all persons affected with tuberculosis globally, KNCV Tuberculosis Plus is hereby committed to ensuring access to this simple, shorter, and safer regimen for all persons affected with drug-resistant tuberculosis globally. We pledge to collaborate with all partners to push for access for this regimen to all and at all levels. We go to scale for impact. We're working together, we will end TB. Yes, we can. Thank you very much.
Thank you very much, Gidado. Another strong call. We now turn to Dr. Daniela Belen Garon, International Medical Coordinator, Médecins Sans Frontières. Over to you, Daniela.
Thank you, Monica and the WHO team. MSF is fully committed with the call for action to shorter and more effective treatment for all patients suffering from drug-resistant TB. People with drug-resistant TB deserve the best standard of care and treatment. It is time to deliver, and the time is now. Thank you very much.
Thank you very much for your passionate words, Daniela. I now turn to Dr. Willow Brock, Vice President, External Affairs, FIND. Over to you, Willow.
Thank you, Monica, and thanks for having us. Like Peter, I'm not a doctor. I'm equally committed to end TB. We at FIND see the importance of testing and ensuring that patients that have drug-resistant TB can easily and quickly be diagnosed and put on the new novel treatments. We have seen that the investments in R&D through public-private partnerships have made such an incredible difference over the last 10 years. And we are truly committed to not just continue the rollout of these new treatments, linking them through testing to the right patients, but also ensuring that better and simpler, faster testing options become available for all patients. Thank you very much.
Thank you very much, Velo, for the support. We now turn to Dr. Kopto Kura, Director, Department of TB from the Union. Kopto, are you online?
Yes, I'm online. Yeah, thank you, Monica, and to the WHO team. So the new short oral regimen will benefit people suffering from drug-resistant TB and the community. So we are here to collaborate with all partners and support the national TB programs, accelerate the transition to this regimen. Let's work together to end TB. Thank you.
Thank you very much, Kopto, for the support from the Union. I'd now like to go back to UNITAID. Dr. Philippe Duneton, Executive Director of UNITAID. We would appreciate your one-line statement of support on the call to action. Over to you, Philippe.
Thank you so much, and thanks for the invitation. I think that I will really highlight our commitment as UNITAID. Working in partnership, working together is absolutely key for simple and better regimen for drug-resistant TB. We have been working closely with WHO and, of course, Médecins Sans Frontières and PRH. And I think that we will have a very good outcome. And I think that to turn the innovation into coverage will make a big difference in the fight against TB and in particular drug-resistant TB. Thank you.
Thanks so much, Philippe, for the commitment from UNITAID. We now turn to WHO Civil Society Task Force on TB. We have Jamilia Ismailova connected. Jamilia, would you like to read out the statement of support from the Civil Society Task Force?
Yes, thank you, dear Monica, and Honorable Dr. Tedros, Dr. Teresa Kasayeva, Your Excellency, Ministers, partners, and friends. This is the honor to join these honorable speakers in the very important event. I thank WHO for this invitation and the ongoing support and leadership of Dr. Teresa Kasayeva in the work of Civil Society Task Force, on behalf of whom I'm speaking here today. Engagement of civil society in communities affected by TB.
Okay, it seems we have some sound issues. Jamilia, we'll come back to you.
Can you hear me now?
Yeah, we can hear you. Yeah, so asking about the one-line statement of support to the call to action on shorter regimens for the Civil Society Task Force. Can you hear us? Sorry
Yes.
for the technical difficulties.
Yes. Regarding the statement from the, thank you, Monica, from the Civil Society Task Force. When we talk about the shorter regime, we should understand that we are talking about the possibility for saving 1,000 lives of people who are struggling with TB. And the shorter regime just gives them hope, the hope that most of them are lost due to the very long and difficult treatment. So as a civil society, task force members. We are fully support the initiative, and in the country, regional and global level, we provide our support to the communities, to the affected population, and we strongly support to roll out the shorter treatment regime. Thank you.
Thank you so much, Amelia. Coming straight from the heart, and a very strong call. So thank you for that. We will now pause to take a virtual group photo. So may I please ask all the panelists to turn on their cameras for just 1 minute so that we can have this, this support in visual format for the call to action. So can we please ask everyone to turn on their cameras, please, all the panelists. Okay, thank you very much. Of course, we have over 150 people who are connected at this online talk show, and we'd like you to engage as well. So if you would like to support the call to action, my colleague here is going to share with you a link on Slido. Please have a look at the chat, or you can use your phone to scan the QR code or go on slido.com and put hashtag TBDay 2023. If you can do this, please, and put your name and the country you're from or the organization you're from, basically to basically sign up and support the call to action. So invite you to go on slido.com hashtag and put the passcode hashtag TBDay 2023 and sign up for this call to action that can really save millions of lives. So we have already Eva Nathanson from United, we have Rebecca from Mexico, Carolyn from Brazil. This is great. Please take this opportunity to express your support as individuals, as organizations. Good to see Kathy from MSF, Santosha from Libya. Please add it on. We will keep this Slido poll open so that you can keep expressing your support to the call to action, and we will take a picture of this cloud poll and share it on our website as an expression of support. So with this, we come to the close of this launch of the call to action session, and I will now turn it back to our director, Dr. Teresa Kasaiva, to take us to the interactive partner panel. Back to you, Teresa.
Yes, thank you very much, Monica. Indeed, it was very inspiring to see strong and united voices and commitments to push forward something very clear, practical, and we know what to expect with the massive implementation of shorter treatment regimens. So we have opportunities, and that brings us hope and to say, yes, that we can end TB. This panel will bring together our closest partners and leaders in efforts to end TB at the global and country level, and they are Global Fund, USAID, Stop TB Partnership, Unitate, Bill and Melinda Gates Foundation, along with the WHO Civil Society Task Force. And our first speaker at this panel will be Mr. Peter Sands. He corrected, Peter, you corrected Monica, Executive Director of the Global Fund, but I must tell that really we community considering you almost as a doctor already because of your profound knowledge. You are diving so deep into the subject that it's really impressive. And even during now World Economic Forum event, when you were speaking about importance of development of new TB vaccines, it was great. It was great, and very right, strong messages directly into the target. So thank you very much for this leadership and engagement, and it's good to have these new opportunities and united efforts, but as the biggest and the main international donor financing TB efforts globally. So what you can tell us about financial support of these very good initiatives, and do we have any new opportunities? We've seen how C19 RM funds and initiative contributed also into the COVID response. Maybe we'll find other innovative ways to address and implement our new tools and approaches. Please hand over to you.
Thank you, Teresa, and thank you for the invitation to take part in this panel. Look, let me start by saying I fully support the Director General's flagship initiative and the call to action. So we are very much by the side of partners in wanting to drive this forward. And we absolutely have to be shoulder to shoulder, because as we approach World TB Day, I think we have to have a pretty realistic and somber assessment of where we stand in the fight against this terrible pandemic. Yes, many countries have made magnificent progress at regaining momentum after the setbacks caused by COVID-19. But when I say magnificent progress, I mean, in many cases, we've got back to where we were in 2019, or maybe a bit better. We are only in very few cases where we originally intended to be in 2020, at the end of 2022, when we were looking back at it in 2019. We're looking forward to it in 2019. And in any case, even those plans really aren't ambitious enough to have any hope of getting anywhere near the targets for TB embedded in SDG 3. We need a real change of gear, a step change in the rate of progress. And that's going to require us to do things differently. It means we do need more money. And I'll come back to that in a moment. We haven't got enough. The total of external resources and domestic resources doesn't add up to enough. We do need to get better at mobilizing the broader stakeholder group, whether it's communities, governments, the private sector. We need everybody really energized about getting rid of this disease. And we do need to get better at accelerating the pace of progress of getting new regimens, prevention, diagnostics, all the different tools we use to the people who need them most. Because although we have made great progress, and BPOM is a really good example in the treatment of drug-resistant TB, it's still the case that far too many people who have drug-resistant TB don't even get diagnosed, let alone treated. And so we still have a massive gap to close there. So I won't repeat what I said about BPOM and drug-resistant TB specifically, except to say we are very committed to accelerating the diagnosis and rollout, the diagnosis and treatment of people with drug-resistant TB and the rollout of BPOM and the most effective regimens. I think the broader things I wanted to touch on are, first, we need to get out of, in a sense, the TB echo chamber. There are many meetings of TB where there are people who are absolutely committed and passionate, and I don't want to be belittling people's efforts at all. Hugely determined efforts to fight TB. But in a sense, we end up talking to people who are converted already. And the problem is that most of the rest of the world isn't very interested in TB. And we somehow need to get them interested. And two of the ways we should do this are, one, in talking about the role of TB in pandemic preparedness. And fighting TB, turbocharging the fight against TB is a fantastic way of building better pandemic preparedness against particularly respiratory viruses. We showed that with COVID, right? So many countries relied on their TB infrastructure capacities to fight the virus. Second, we need to make sure we are not a kind of side part of the efforts around antimicrobial resistance, but a central plank of that effort. And then third, we need to tell the story of why fighting TB is a fundamental foundation for building universal health coverage, UHC. Japan did that in the 50s and 60s, and it's a fantastic example of how you can use social mobilization, a national campaign against a disease that's killing huge numbers of people as a platform to create a truly inclusive, universal health system. I'd also highlight the importance of locating TB within all the debates that are going on in the world around climate change. Unlike malaria, which is directly and intuitively affected by, or cholera or dengue by climate change, TB is affected mainly in a sort of second order way, but it's a very powerful second order. With climate change and with the amount of conflict we're seeing in the world, we're going to see, unfortunately, high probability, we're going to see very large numbers of displaced people and refugees. People fleeing parts of the world that become desertified or that are just too hot to be in, and conflict for resources, water, and so on, leading again to large numbers of displaced people. And we all know that TB likes nothing more than highly stressed populations living away from home in tents or other sorts of impromptu accommodation in highly crowded circumstances. We need to think about our models for TB prevention and treatment and diagnostics for very large numbers of people who are displaced from their homes, because that is going to come at us, and it's going to come at us, sadly, pretty fast. I mean, it's with us already, but it'll come at us more. So I think we need to be thinking about TB not just as the disease we know and as a TB community. We need that at the core. And as I say, I'm not diminishing the importance of having this strong network, but I'm saying we need to leverage and reach out and be part of these other agendas. And one last comment I'd make about that is the private sector. I think there is an opportunity to leverage more effectively initiatives, fantastic initiative, Ending Workplace TB, which engages companies in actually dealing with the TB present within their own staff populations and the families of those staff members. If we could scale that up, if we could make it more action-oriented, more metric-driven, that's a very powerful tool and a very powerful way to bring the economic argument in. Because one thing that's very clear is that when companies actually tackle TB in their own staff, it's not just the right thing to do as a caring employer, but it's an economically and business logic. Just reducing the numbers of FTEs lost to people being sick or on treatment by prevention, by eliminating TB from the staff is hugely beneficial. So I'll stop there. But as I say, I do think we should be seizing the opportunity of this World TB Day to get the TB story injected into some of the other agendas that are driving global policy, and to increase our ambition around the pace of progress we make. Thank you.
Peter, I can't agree more, and fully support your vision and your ideas. Yes, it's true, we should go beyond our traditional round of partners and stakeholders, and we should be seen far beyond. And these 3 high-level meetings back-to-back, UHC, pandemic preparedness, and TB meeting, gives us a really unique chance. Initially, it was seen like as a challenge that probably there will be some competition between these agendas, that we could be lost, but in fact, it's a great opportunity for us, and our advocacy and voices should be heard at the UHC meeting, pandemic preparedness meeting, meetings that let's showcase with TB, if you would like to show how in practice UHC principle and pandemic preparedness and response principle works. It would be quick wins because our ground is prepared better than any other grounds and programs. So that's why I fully support your vision. Let's continue working together, and thank you for your leadership. So now moving to our next speaker, who doesn't require any special introductions, Dr. Lucica Ditiu, Executive Director of Stop TB Partnership. And Lucica, I know that you are in Varanasi now preparing to a very important event. And I had yesterday, I've been in New York, as I told, we had excellent missions briefing. And when they asked about our achievement against commitments made at the first high-level meeting, one of the achievements that was presented, it's real true achievements, that slogan of the first meeting was "Unite to End TB." And we've really advanced in this direction. We are much more united in our efforts, in our messaging, in our key asks, and so that is big step forward and brings us hope that we are much stronger and can do much more, and we are already doing many important things. So that's why we can celebrate already these achievements, but of course much more should be done. And thank you for your engagement in the first the Director General initiative, and in the second we've been working closely, and the first presentation and discussion happened with you, with Director General recently. Global Fund is closely engaged and other partners. So please tell me your vision and what would be your call to action before high-level meeting, and what, please share your thoughts.
Thank you so much, Teresa. I think, you know, I want to say, first of all, that thank you for making this happen. And also thank you very much for everyone that took the time to be here. Teresa spoke about the fact that we are more united than ever. And I think even the fact that we embraced with so much enthusiasm, all of us, this slogan, yes, we can end TB. You know, when we developed it, we were a bit hesitant. But we realized that actually we construct this on the hard work that is happening at the country level. And according to our predictions, and I would say my own bet, is that 2022 will be proven as the best year in terms of detecting people with TB so far, and the year that will probably show that we will go below 3 million missing people with TB. We will be, and I love that Peter is giving me thumbs up, because if that's the case, and sorry, Teresa, I will speak what will be my call to action. I just want to, all of us, to, how to say, embrace that. Because if in 2022, when we were still fighting TB, when we were still fighting COVID, with the budgets that we have in TB, with the burden that we have, and with the staff that we know is overworked but highly committed, if in that situation we are able to detect the biggest number of TB ever. We heard about Indonesia, we know India is following, we know South Africa, we know Nigeria, we know Bangladesh. If we go below 3 million missing people with TB, that will be the best achievement in the history. And if we did that in 2022, we can do it every year, less and less missing people, till we will be able to end TB by 2030. My call is actually something that we will, share here and push, is linked to the fact that we have a good narrative, and the points that Peter made and others during this discussion about sharing this narrative, and you, Teresa, sharing the narrative about TB outside TB, and making the links with the things that are happening right now, and showing how TB, which is an airborne pandemic, that nobody here should say that is not the case, even though we have the narrative of the PPR groups doesn't necessarily include TB, but we will change that because it is an airborne pandemic. We have a changed narrative. We need to have it put to a right audience. And from Stop TB, as we are now buckling up for the UNHLM, we will create a special advocacy platform with heads of states that will be part of a coalition of leaders that will speak and will champion TB till the UNHLM, but also beyond that towards ending it. And we will construct that on the leadership of Prime Minister Modi of India, that we know that not only that called for an end to TB in 2018 by the end of 2025, but actually put in place and in motion a lot of amazing initiatives here in India. We will build on the President Joko of Indonesia's leadership and very strong vision of ending TB together with the team of the Ministries of Health, as well as the President Lula da Silva of Brazil. And hopefully, from what we know so far, as well, the President of Nigeria, following the links that we used to have in the past with Nigeria, who went under elections. So the dream is to have a group of the highest 5-6 high burden countries that can really push the TB agenda, not only till the UNHLM, but beyond. So that's one of the commitments that we want to do. But the biggest overarching one, because that's just advocacy, is to basically, and not basically, as you said, Teresa, to join hands in this DG flagship initiative and in embracing and further pushing the overarching targets that we will have in the DG flagship initiative and in the UNHLM. The last thing that I want to say is this. Very often we are very shy and a bit discouraged in TB sometimes, you know. It's time now, and I want to all of us to use 2023 as the year of changing the narrative, in which TB is seen as part of the current contemporary topics of discussion on the global health, but also contributing and showing how the difference can be made for health of people everywhere through the investments in TB. And that should be, this should be a reset for saying that and for fully believing that, yes, we can end TB and together we will do it. And we should not wonder anymore. We should just go ahead and do it. If it doesn't work through the right hand, we should try through the left hand, and so on and so on. So thank you, Teresa. And I'm very happy to be part of this and hope to see those of you coming soon in Varanasi, where it's very nice and hot, and where we will all embrace and celebrate in an ancient city, an ancient disease. Thank you.
So thank you very much, Luchika. Hope to see you soon in person in Varanasi, where I'm sure we'll have another round of very important discussions, and we'll see strong commitment and amazing leadership. Thank you. Our next speaker will represent another important stakeholder, partner and donor, U.S. Agency for International Development, USAID, Dr. Mukadi Yadiul. Mukadi, we really acknowledge huge efforts and tireless work that USAID is doing, supporting countries. It is the largest bilateral TB donor and working closely with WHO and all the partners. We know also that recently you've developed new strategy, and looking forward to the second high-level meeting, what will be your messages and expectations as representatives of USAID, please?
Yeah, thank you very much, Teresa, and glad to make this this talk after both Peter Sands and Ruchika, who really eloquently introduced the subject of TB to all of you. Just to follow up on Peter Sands on his comment, just want to remind people that last year we did put forward our strategy for TB that is going to be taking us for the next 7 years. And then that strategy, if you haven't time to read it, I'm just encouraging you to read it to see that we are really putting TB in where Peter Sands had mentioned that we have to be addressing the element of climate change, putting TB within the context of pandemic preparedness and universal health access in primary healthcare. So at this moment, we are in the process of translating that strategy into an operational approach that is going to be guiding our country in terms of implementing these activities. So we hope that in the next 7 years, we're going to be seeing all the different elements that have been mentioned by Peter Sands being implemented in different places in different countries. Right now, USAID provides services, bilateral support to 24 countries. Those are high burden countries where we have intimate relationship with the government, but we also do provide technical assistance to an additional 31 countries. But in all countries, what we're trying to do right now is really pushing the agenda of our strategy. The strategy is evolved around 4 specific themes. That is, we want to reach everyone that has TB. And then in order for us to do that, we have to use the tools that are available to us, but using the most and the more accurate tools, such as the molecular testing. We are realizing that we are not really testing many of the drug-resistant TB patients because we are not really using what is molecular testing. So we have to make that effort to have the molecular testing being used. We have to identify the missing cases through digital X-rays as well, that is coupled with a artificial intelligence software that can help us in terms of quickly identifying this abnormality that the patient might be presented. And then we also looking at the different approaches for doing the finding cases, not really within the facilities, but really expanding the places where we're going to be finding cases, going within the community, going within the household. We're doing this in partnership with the government, with community organization, with the community that are affected, but we are implementing through local organizations. So as you can realize that most of our activities are now being implemented by local organizations that are really taking the lead in terms of coming up with the local solution to the local problems. That is something that's very important. As a result of what we've been doing on the diagnosis side, we've seen a significant increase in the TB case notification. So that one Chika said that 2022 will be the year where we've seen a very huge increase. We should be asking the questions, how did we reach that increase? What had happened? What do we have to do to maintain or go above what we've done? Because if we don't do that, we're going to be in big trouble. We don't want to see us going up and then going down the next year. So that is really very, very important for us to do that. That is one of the exercises that we've been doing internally to try to find out what is going on. We have few theories on what is going on in terms of finding these cases, but I can at least from now say that our approach of working with local organizations, going within, moving the case finding within the communities, using digital X-rays is one of the tools. We are starting seeing all these things coming out in terms of finding TB cases. The second element of our strategy is on the treatment side. We want to make sure that anyone that's been identified is receiving the appropriate treatment, and the treatment should be following up the WHO regimen, including using all the recommendation coming from the WHO, the BPAL regimen, as you guys have mentioned it today. It's really very important. That that's something that we also we've been pushing for the country to implement for the patient that have drug-resistant TB. We want to make sure that the treatment is not only giving the pills, but also making sure that we have the element of support to the patients. The third element is focusing on the prevention, and we've been really using contact investigation as our approach for finding patients that are individuals that are in need of receiving TB preventive treatment. And then we are moving for only focusing on children, HIV-infected individuals, to also look at adult contacts to the TB patient, to the TB the individual, and making sure that they are all receiving TB preventive treatment using the 3HP that we're really pushing forward as one of the tool for preventive treatment. The one element that we have on our strategy is focusing on the research and innovation. We have to be clear here that we will not going to be ending TB if we don't really have new tools coming up on board. We have new medicines. I think that we might be celebrating today BPAL. We know that the resistance that are coming out slowly on bedaquiline that we need to have a new drugs. So the pipeline that we have right now need to be maintained. We need to keep on growing, and we need to put resources into investing into new medicine. We need to put resources in investing into new diagnosis tool because we really don't have new diagnosis tool. This is something that we're doing right now within USAID with the new project that we have, the Smart for TB, which has studies that are focusing on TB diagnosis, working closely with our colleagues from FIND and trying to find out what would be the best tool for making the diagnosis, as well as what are the best specimen that need to be collected, and running away from sputum to the other specimen for diagnosis. And then finally, the element of the vaccine. We haven't really talked a lot about vaccine, but there is a vaccine that is getting into the phase 3 trial right now. I think that supporting that vaccine will be very important, but supporting the use of that vaccine will be something that's going to be very important, specifically looking at the behavior change that will be happening. What are the factors that will be influencing the uptake of the vaccines? Those are things that we have to start studying right now. This is something that we're doing with the Smart for TB project that we've started. So in a nutshell, I think that we're going to be going to the UNHLM saying that, yes, I think that this is really, we are making progress in terms of TB. There are strategies that need to be implemented. We have to fit TB within all these different elements that we talk about, pandemic preparedness, climate change, and other, but the element of the innovation should not be forgotten. So I'll stop here. Thank you.
Mukadi, thank you very much for your really comprehensive, the sharing of all the priorities that we should put up front, and setting scene for our next speaker. It will be Philippe Duniton, Executive Director of UNITAID, UNITAID is really playing also a very important role spearheading efforts on TB research and innovations. And again, this question coming to you, Philippe, as we're looking forward to the 2023 high-level meeting. So what we should to achieve and prioritize in the area of research and innovation. Many important achievements we can celebrate with under the leadership of UNITAID, your close work with the partners, with WHO. Please share your thoughts and what should be prioritized and what are real perspectives in the research and innovations agenda.
Thank you, Teresa, and thanks for all the colleagues and partner and country around the table. Look, I think that what I want to stress is to stress the importance of the alignment of the one who are part of the response, the agencies in the countries. And I think that the two keywords for me is to be focused and to be comprehensive. And we come back to that. But first, I think that we need to agree on two things. One is that we are not where we want to be in the fight against TB. It's obvious today, it was said by others and Peter. But also we have to recognize that if you compare to the situation 10 years before, most of the tools we can use today were not available. 10 years from to now, I mean, it was 2 years with injectable for drug-resistant TB. It's insane, and multiple regimens and different costs. So I think that we have contribute as UNITAID, but as the partners, as all the partners, to have now clear recommendation with evidence supported by WHO that we can use, that the country can use, and it's a major shift. And we need to recognize, sometimes we can be depressed in TB, but also we have to recognize the good news because it's real. And we need to continue to invest. I think that our colleagues from USAID has mentioned the preventive treatment with 1 HP for people living with HIV. I think, frankly, it's also a major shift that didn't exist 10 years ago. And we have been proud to contribute to that response. I can, of course, mention the work that we have been doing in TB. But clearly, one of the key elements is diagnostic still. I think that we need to continue to work in partnership with FAN, USAID to have better tools in terms of diagnostic. And we know that in the pipeline, there are things that are quite interesting, and we have already invested into that. And I think that's also a major change. I mean, of course, I support fully the call for action on drug resistance. I just want to mention that it's a hard work, but we need also to have better treatment and more pediatric formulation, because of course it's a limited number of kids, but to be honest, it's really, really difficult today to cope with drug-resistant TB among the children. And we have invested into that. I hope that in the coming month, we have some simplification, of course, not such as the sensitive TB that we did, but to be honest, I think that really we need to continue to push. So again, I think that in terms of potential innovation, I think that we are quite aligned. Of course, we are proud to be one of the biggest agencies to invest in R&D, but in a way, it's quite a small investment compared to what needs to be done. So I think that we need to continue to push to have more investment. Our colleague also from USAID mentioned the vaccine. I think we need a vaccine also from TB. And of course, we are looking with good news. So to be focused is to address this. But if we want to be successful, I think, as we said, we need to be more comprehensive and recognize that, you know, looking at TB, do better job in TB is not only to fight TB, but it's also the way to address the public health needs. We had a discussion with the colleagues of ACTE last week. It was the last meeting of ACTE, and the special envoy asked us to say, well, let's see how we can do better next time, because of course we all recognize the challenge we have faced in the COVID-19 response. And I think that we came to an agreement that if we want to be better the next time of the pandemic, we need to better address the job we have to do now against the current pandemic, including TB. The only way that we can have a better preparedness is really to think about how to better address the need in terms of diagnostic, in terms of case management of infectious disease. And I think that's the kind of thing that we need to implement and discuss with the country and think about how we can organize. I mean, many of us are making the point that, you know, an airborne disease is an airborne disease, and the way to deal with that should be more comprehensive. And I think that in the discussion we have with a lot of countries, I think that they need to better understand a more comprehensive way to deal. I mean, okay, be specific in terms of TB is absolutely key. Be more comprehensive and to say we need to build a system that can deal with infectious disease, including TB, but also the response to potential pandemic is absolutely key, because we have the same issue in terms of diagnostic. So to have a multi-pathogen platform, for example, to deal with a diagnostic will help with a lot. And we know it's coming. We know with the work we are doing with FIND and the Global Fund that this is really what we should push. So, and I think that it's the people understand that, but we need to push in that direction to be more efficient in the response globally for infectious disease, but including TB. So again, I think it seems weird to talk also about climate change, but climate change is a reality that is coming at us more fast than we thought, and it will have a lot of impact in terms of global health, but also at country level. And so we cannot just reinvent the way we respond to the new crisis. We have current crises. We have crises that we can anticipate that they are coming at us. And so again, be more comprehensive is to have that kind of view and think about the global response. Again, to be focused is important. Focus in TB, focus in MDR-TB for sure, but also how to be more comprehensive and more effective in the response is a question that we have all first to align, to work on, and to have the support from countries. Over. Thank you.
Thank you very much, Philippe, for your very clear and strong messages, and in general for the very important work what UNITAID is doing and great partnerships. And indeed, the research and innovations agenda is heavy, and investments we may say tiny, but how impactful they are. And we should not be shy, and we should really bring this case. So how many things we've managed to achieve, because when we are looking for additional investments, no one would like to be part of failure. Everyone would like to see some perspectives and successful story at the end, and that will attract more investments. And I fully agree with you. To prepare, predict, and prevent is always much more effectively neither respond. So that's why with these messages, let's hope that we will be able to convince member states to include them and build on them their commitments. We are very pleased, thank you, Philip. We are very pleased also to have with us Daniel Chin, Deputy Director for Global Health, Bill and Melinda Gates Foundation. Also our close partner, a very important partner, leading the way on addressing key gaps along the TB care pathway through new approaches and to provide protection against infection, prevent progression from infection to disease, improving diagnosis and treatment, as well as research and development, including for new vaccines. Daniel, I have the same question to you. What are your key priorities and key messages that we should jointly share with the member states and encourage them to commit on?
Well, thank you, Teresa, for the invitation to participate in this World TB Day interactive panel. The Gates Foundation has a strong belief in the power of innovation to bring about a more healthy, productive, and equitable society. 5 years ago at the UN high-level meeting for TB, Bill Gates joined a call to increase investment in and to make progress toward TB R&D. Now, 5 years later, and as we look forward to the upcoming UN high-level meeting, I'm actually pleased to be able to say that we have actually made major progress in TB R&D, which has, and they have the potential to actually transform TB care and prevention. I think this is actually quite remarkable because we actually saw a major regression in TB diagnosis and treatment during the pandemic, but research and development in TB has actually made progress and substantial progress. We were one of the key funders in the development of the new 6-month highly effective oral regimen to treat those affected by drug-resistant TB. And we're very thrilled. I mean, you know, the focus of one of today's meeting session is to really advocate and to push for the rollout of this regimen. And we strongly endorse the use of this as a life-saving treatment for those affected. I actually don't think it's actually a cliche to actually say that together we can end the suffering of those with drug-resistant TB. And I would say, yes, we can do that, and we can do that now. But we should not be satisfied with this progress. And so together with many partners, we're working toward having a 4-pill-a-day TB regimen that can only take 2 months to cure a patient within 5 years. And even if they have drug-resistant TB, this drug regimen could be paired with a new TB diagnostic that are available for TB diagnosis at a point of care where patients seek care. And this will be available, we believe, within the next 2 years. And this can utilize a tongue swab instead of the difficult to collect sputum. All of this could allow us, and we believe will allow us, to eventually pair point of care diagnosis with ultra short TB treatment as soon as patients seek care, including for those vulnerable and marginalized patients like the refugees that Peter talked about earlier. And in 5 years, we'll be well along in completing the clinical trial of at least one new TB vaccines. And one of these trials, we believe will start in 2024. And that will be a game changer as we approach 2030. But while we can be optimistic about the recent progress, the pipeline for new TB tools is still quite thin. And there will be setback in research and development along the way. So we need to increase TB R&D investment now to get the job done. So we strongly support WHO's call to advocate for increased TB funding and to accelerate the rollout of new drug regimens and to increase testing with point-of-care diagnostic so that the large share gap that currently exists in finding and treating missing cases, TB patients, can be closed within the next few years. We also need to accelerate progress to deliver on the UHC promise and to strengthen primary healthcare, because only by doing so will we be able to do better with the tools that we have right now to fight TB and to improve the effectiveness of any new TB tools that come down that we will be available in the next few years. But in parallel, we also need to make smart decisions now on how to use the funds that we have and what innovations to scale up to maximize impact. Not all innovations have the same value. That is, they do not bring equal benefits to TB elimination. So if we want to rapidly scale up the most effective TB innovations to drive impact, we have to be smart about the choice that we make, because our resources are still currently limited. And I'm talking about both human and financial resources. So therefore, we support efforts by WHO and other partners to help countries to prioritize the TB response better, so that maximum benefits can be achieved now using what we have, and better choices can be made to roll out new TB innovations as they become available. And finally, as we work on delivering TB services and innovation, we need to keep in mind the patients who we're aiming to serve. Patient-centered care requires our engagement with patients as soon as they are sick. This is a major focus of our work. And globally, we recognize, and all of us recognize, that 60% of TB patients initially seek care in the private sector. And this includes private providers in small clinics, in hospitals, in pharmacies, and chemist shops, and even informal healthcare sectors. Most of our missing TB cases are in high-burden countries with large private healthcare systems. And the greatest progress in finding missing cases, TB cases over the last five years have been made in these countries because of efforts to reach out to the private sector in these countries, and to support these providers to identify and treat TB patients. And the foundation is really glad to see partners like the Global Fund, the World Bank, WHO, Stop TB Partnership, and others supporting these efforts. And we will continue to do our part to ensure that any new TB innovations will reach all patients in both the public and private sector. So in conclusion, as we look forward to the UN high-level meeting, we endorse and support WHO's flagship initiative to accelerate global and country response to TB. And our call and our support is to, and our commitment is to increase our, our call is to increase funding support for TB R&D, to increase funding to scale up the most impactful interventions, and to ensure that innovation can be delivered in a patient-centered manner to all patients in both public and private sector. Thank you.
Daniel, thank you very much for your very powerful messages. And I fully agree with you that hard work is absolutely essential to do our best for the patients and to drive this heavy agenda, but it should be complemented by optimism. So optimism plus hard work, and we have much more reasons for this optimism than we have even a few years ago. So that's why let's believe that it is possible and it will become possible. So thank you very much, Daniel. Now we are moving to our very important last speaker for today, Jamila Ismailova, representative of WHO Civil Society Task Force on TB. And we've started with the voices of the representatives of the communities, affected communities. We would like to end again with to hear from the civil society representatives what should be the most important call for actions from the civil society task force perspectives. We know that you're very passionate about a perspective of multisectoral engagement and accountability, and playing very important role at the global level, regional, and also in the countries as the drivers of this important agenda. Please share your thoughts and messages on behalf of the civil society task force.
Thank you, Dr. Teresa, and dear honorable partners, friends, and Your Excellency, Ministers of Health. First of all, I would like to thank WHO for this initiation and the ongoing support and leadership of Dr. Teresa Kasayeva in the work of Civil Society Task Force, on behalf of whom I'm speaking here today. Engagement of civil society and communities affected by TB is vital for an effective TB response. This has grown since the 2018 United Nations high-level meeting on the fight against tuberculosis. But more extensive and meaningful engagement is still needed, particularly on the aspects of sustainable financing, including the domestic sources. Financing capacity building and organizational development of TB support groups and participation in decision-making on political and programmatic aspects of TB response. While the most vital work of civil society is happening in the country and communities, global leadership and alliance among international participants is crucial to create the conditions for success. The WHO Civil Society Task Force on TB, which was established in 2018, continues to meet regularly and engage with the WHO Director General, engage with government in WHO policy settings and guidelines development process, and collaborate with the key bodies at global and regional levels. In 2021, the task force issued a joint statement with the WHO Director General, highlighting urgent actions needed to stop preventable death and suffering due to TB, and recover gains lost during COVID-19 pandemic, and in 2022, a joint call for action for TB UNHLM in 2023. The openness of WHO and all stakeholders within this process has built trust, increased transparency, and allowed us to focus more closely on our common goal to end TB. We as a task force are also engaged in advancing the multi-stakeholder engagement agenda. Progress towards ending TB will depend on action across sectors as per WHO's multisectoral accountability framework for TB. The task force collaborated closely with WHO to produce a tool for accessing the engagement of civil society and communities within the national baseline assessment. And I'm talking about the Annex 2 of the MAF-TB. We have since been supporting countries and civil society partners to ensure MAF-TB processes and participatory with meaningful engagement of civil society and TB-affected communities in all related processes. The COVID-19 pandemic tangibly demonstrates to the international community, government, and activists alike that the fight against infectious disease knows no border, and provides a number of lessons on how to respond to such challenges. WHO and Stop TB analysis have demonstrated that TB response has regressed at least 8 years as a result of the pandemic. While the pandemic presented serious challenges, as articulated in the WHO Global TB Report and Deadly Divide Call for Action 6, we must collectively leverage the COVID-19 response to strengthen national TB responses. One of the lessons learned is that all countries are united with a sense of urgency to act and respond with communities placed certainly to ensure continued access to essential services and access to correct information. Furthermore, MAF-TB is steering wheel, mobilizing political commitment to ensure continuous progress in ending TB. Finding ways to support sustainability in TB response in times of health emergencies, conflicts, and the energy crisis will be crucial. The CSTF member, jointly with partners, lead the country and regional support on operationalization and country context adaptation of the MAF-TB with strong civil society engagement, developing of guidance and tools for advancing action on MAF-TB in countries, advocating for the use of MAF-TB tools in the national dialogue to strengthen partnership between civil society, TB-affected communities, and national TB programs to ensure true centered TB services. We are currently engaged in a series WHO co-hosted social listening webinars for grassroots communities and civil society on UNHLM 2023. They are taking place in all WHO regions. The findings will be compiled in a global report in time for the interactive multi-stakeholders hearing in May this year. Our call for action for the UNHLM meeting on TB for 2023 is mobilize sufficient funding for universal access to quality TB response and for all types of TB. Without proper funding, all the UNHLM commitment will be useless. We also advocate for the elimination of stigma, discrimination, and other rights-related barriers to affordable and equitable access to care. People need to be at the center of the response and community as an equal partner. We need to ensure that all health systems are resilient and sustainable. Therefore, include community system as their continuum with a fair and sustainable financing of both increased investment in community capacity building, including more direct funding and boosting partnership for joint interventions. We need meaningful engagement of TB-affected communities and civil society in decision-making systematically. We request all sectors and stakeholders to work together. We emphasize the need for multi-stakeholder engagement and accountability in the TB response. We demand a major advance in the development of novel TB vaccine. The newly announced Director of General Flagship Initiative with the 5 strategic pillars, engage, accelerate, align, and account, and advocacy is the way to go. We strongly believe, yes, we can end TB. Thank you very much for your attention.
Thank you very much, Jamila. We are proud to work with you and with your colleagues from the WHO Civil Society Task Force, and of course with all civil society representatives and partners. We are coming to the end of our talk show. As usual, we've discussed many topics, but we don't have enough time to cover everything, but we will have more opportunities, and this dialogue will be continued. And so as we're looking forward to the second high-level meeting on TB. I would like, we promised to respond to the question. Actually, we've responded. Colleagues are here. All the global TB program experts are here sitting, and I would like to use this opportunity also to thank them all for their hard work and passion to drive our joint agenda forward. And you can find responses in the chat to the key questions shared with us, but please continue reaching us through the interactive planner platform, and we will be happy to continue this interactive dialogue with all of you. So, distinguished participants, colleagues, partners, and friends, today's discussion have been inspiring and productive. And I'm sure, and we're all sure, will help us and the world to share our advice and our recommendations how get back on track to end TB. We cannot falter in our commitment till we reach and save every person, family, and community impacted by this deadly but preventable and curable disease. No more excuses and delays in prioritizing and investing to end one of the world's top infectious killer. Together, yes, we can end TB. We must end TB, and we should end TB. Thank you very much.